Hello, I'm Dr. George Ampad and I work as a consultant orthopedic surgeon in Liverpool in United Kingdom. Knee pain and knee arthritis. What exercise should I perform to help patients with arthritis of the knee? Patients wrongly assume that exercises like walking and swimming will help with arthritis of the hip and knee. Walking and swimming can help with symptoms of hip and knee arthritis, but resistance or strengthening exercises have a greater beneficial effect. There are 4 types of exercises to perform to tackle all the issues related to hip or knee arthritis or hip or knee pain. We have created a plan to help you perform certain exercises to help alleviate the pain in your knee or your hip. The plan is called Arise. There are 4 different types of exercise, which includes 12 different exercises. We will cover all of them in detail. The different types of exercises are A. Awareness of the body. R. Resistance and strengthening exercises. I. The I in the center denotes you. S. Stability of the core. And E. Essential and functional exercises. The word arise has been coined with the I in the center. Our hope is that by putting you in the center of the plan, you can arise out of disability and become more functional and pain-free with this method. We believe you can. You need to believe you can. To begin with, only do level 1 exercises. After repeating the exercises on many occasions and only after becoming stronger should you progress to levels 2 and 3. A. Awareness of body exercises. These exercises help to reinforce your brain's awareness of the position of your joints and limbs in space. Even without looking, our brains know if our leg is in front or behind our body. That knowledge is called proprioception, which is simply an awareness of where your body is in space around you. There are 2 exercises which can help to reinforce that knowledge, and they are forward lunges and 2 side lunges. The next type of exercises are resistance or strengthening exercises. These exercises are performed against resistance and are known to increase the strength of weak muscles quickly. The following 5 exercises are the resistance and strengthening exercises. They are forward flexion, extension, abduction, front knee strengthener, and back knee strengthener. The next set of exercises are the stability of the core exercises. The core of the body involves the pelvis and the lower back, the abdominal muscles, the muscles around the spine, the diaphragm, which is the sheet of muscle that separates the chest from the abdomen, and the thigh muscles all form part of the core. The limbs move around well with a strong core. The following 2 exercises will improve the strength of the core, and they are side plank and back plank. The last group, E, essential and functional exercises. Your normal day-to-day activity involves getting in and out of a chair many times. In arthritis, the ability to stand up from a chair reduces due to pain, and one may need a higher chair in order to make it easier to stand up. The exercises in this section will help you regain the ability to stand up from a sitting position regardless of the height of the chair. There are 3 exercises within this group, and they are 1. Knee bends, 2. tiptoe, and number 3, lastly, sit to stand. I hope these exercises help you with your arthritic pain. Thank you very much for listening.
Exercise 1. Backward lunge. Level 1. Stand behind a chair facing forwards. Hold the back of the chair with both hands and look straight ahead. Place the sliding disc underneath the left foot. Bend the right knee and the right hip and lower the body by a few inches while sliding the left foot backwards in a straight line. Then return to the original position by standing up and bringing the left foot forwards. Repeat 5 times. Swap and alternate legs and repeat 5 times. Exercise 1. Backward lunge, moving the left leg. 5, 4, 3, 2, 1. Swapping to the other side and moving the right leg. 5, 4, 3, 2, 1. Exercise 1. Backward lunge, level 2. That is without the use of a chair. Only progress to this level if you are confident with level 1 described previously. Clasp both your hands and hold it about 6 inches away from your tummy. Place the sliding disc underneath the left foot. Bend the right knee and right hip and lower the body by a few inches while sliding the left foot backwards in a straight line. Then return to the original position by standing up and bringing the left foot forwards. Repeat 5 times. Swap and alternate legs and repeat 5 times. Exercise 1. Level 2. Backward lunge. 5, 4, 3, 2, 1. Swapping to the other side. Exercise 1. Level 2. Backward lunge. 5, 4, 3, 2, 1. Exercise 2. Side lunges. Level 1. Stand behind the chair facing forwards. Hold the back of the chair with both hands and look straight ahead. Place the sliding disc underneath the left foot. Bend the right knee and right hip and lower the body by a few inches while sliding the left foot towards the left and away from the body in a straight line. Then return to the original position by standing up and bringing the left foot inwards and towards the center. Repeat 5 times. Swap and alternate legs and repeat 5 times. Exercise 2. Level 1. Sideward lunge. 5, 4, 3, 2, 1. Swapping to the other side. 5, 4, 3, 2, 1. Exercise 2. Side lunges, level 2, without the use of a chair. Moving the left foot. Only progress to this level if you are confident with level 1 described previously. Clasp both your hands and hold it about 6 inches away from your tummy. Bend the right knee and right hip and lower the body by a few inches while sliding the left foot towards the left and away from the body in a straight line. Return to the original position by standing up and bringing the left foot inwards and towards the center. Repeat 5 times. Swap and alternate legs and repeat 5 times. Exercise 2, sideward lunge without the chair, level 2. 5, 4, 3, 2, 1. Swapping to the other side. 5, 4, 3, 2, 1. Exercise 3, hip flexion, level 1. Apply ankle weights to both legs. Stand sideways behind a chair with the left side of the body closer to the chair. Hold the back of the chair with the left hand and look straight ahead. Slowly lift the left leg forwards, lifting the foot by about 10 centimeters above the ground. Then lower it down to the original position. Lifting the left leg up is slightly quicker than returning to the original position. Lift up to a count of 2 and return to the original position to a count of 3. Repeat 5 times. Swap and alternate legs and repeat 5 times. Exercise 3, hip flexion, level 1. 5, 4, 3, 2, 1. Now moving the opposite leg, the right leg. 5, 4, 3, 2, 1. Exercise 3, hip flexion, level 2, without the chair. Only progress to this level if you are confident with level 1 described previously. Apply the ankle weights to both legs. Stand upright and look ahead. Clasp both hands and hold it about 6 inches away from your tummy. Slowly lift the left leg forwards, lifting the foot by about 10 centimeters above the ground. Then lower it down to the original position. Lift up to a count of 2 and return to the original position to a count of 3. Repeat 5 times. Swap and alternate legs and repeat 5 times. Exercise 3, level 2, hip flexion without the chair. 5, 4, 3, 2, 1. Swapping to the other side. 5, 4, 3, 2, 1. Exercise 4, hip extension, level 1. Apply the ankle weights to both legs. Stand sideways behind a chair with the left side of the body closer to the chair. Hold the back of the chair with the left hand and look straight ahead. Slowly lift the left leg backwards in a straight line and lift the foot by about 10 centimeters above the ground. Then lower it down to the original position. Lift up to a count of 2 and return to the original position to a count of 3. Repeat 5 times. Swap and alternate legs and repeat 5 times. Exercise 4, hip extension, level 1 using the chair. Moving the left leg. 5, 4, 3, 2, 1. Opposite side. Moving the right leg. 5, 4, 3, 2, 1. Exercise 4, hip extension, level 2, without the chair. Only progress to this level if you are confident with level 1 described on the previous page. Apply the ankle weights to both legs. Stand upright and look straight ahead. Clasp both your hands and hold it about 6 inches away from your tummy. Slowly lift the left leg backwards, lifting the foot by about 10 centimeters above the ground. Then lower it down to the original position. Lift up to a count of 2 and return to the original position on a count of 3. Repeat 5 times. Swap and alternate legs and repeat 5 times. Exercise 4, level 2, hip extension without chair. 5, 4, 3, 2, 1. Now on the opposite side. 5, 4, 3, 2, 1. Exercise 5, hip abduction, level 1. Apply the ankle weights to both knees. Stand behind the chair facing forwards. Hold the back of the chair with both hands and look straight ahead. Slowly lift the left leg sideways, lifting the foot by about 10 centimeters above the ground. Ensure that the foot is pointing forwards. There is always a tendency for the foot to turn outwards. If it turns outwards, then the wrong muscle is being used. Then lower it down to the original position. Lift up to a count of 2 and return to the original position on a count of 3. Repeat 5 times. Swap and alternate legs and repeat 5 times. Exercise 5, hip abduction, level 1, moving the left leg. 5, 4, 3, 2, 1. Swapping sides. 5, 4, 3, 2, 1. Exercise 5, hip abduction, level 2, without the chair. Only progress to this level if you are confident with level 1 described previously. Apply the ankle weights to both legs. Stand upright and look straight ahead. Clasp both your hands and hold it about 6 inches away from your tummy. Slowly lift the left leg sideways, lifting the foot by about 10 centimeters above the ground. Ensure that the foot is pointing forwards. Then lower it down to the original position. Lift up on a count of 2 and return to the original position on a count of 3. Repeat 5 times. Swap and alternate legs and repeat 5 times. When abducting, it is important to see that the feet are pointing forwards and don't rotate to the outside. There is a tendency to rotate the foot and do this, but then we would be using the wrong muscle. So it is important to keep the feet pointing forwards so only the abductors can be used. So it's important they are lifting sideways and not turning like this and lifting. Thank you. Exercise 5, hip abduction, level 2 without the chair. 5, 4, 3, 2, 1. Swapping sides. 5, 4, 3, 2, 1. Exercise 6, front knee strengthener. Sit comfortably with the knees bent and feet flat on the floor. Apply the ankle weights to both legs. Slowly straighten the left leg. Once the leg is fully straight, slowly bend it, returning to the starting position. Lift up on a count of 2 and return to the original position on a count of 3. Repeat 5 times. Swap and alternate legs and repeat 5 times. Exercise 6, front knee strengthener, level 1. 5, 4, 3, 2, 1. Swapping legs with the other one. 5, 4, 3, 2, 1. Exercise 7, back knee strengthener, level 1. Stand up straight, holding onto the back of a chair. Look straight ahead. Slowly bend the knee of the left leg until it is at a 90-degree angle. Once the left leg is at a right angle to the thigh, slowly lower the foot to the floor. The foot should be lifted backwards by bending the knee. Ensure that the knee thigh does not move forward when doing this exercise. Lift up on a count of 2 and return to the original position on a count of 3. Repeat 5 times. Swap and alternate legs and repeat 5 times. It is important to note that we have to bend the knee backwards and not to bend the knee this way. So you have to align both the thighs or both the knees at the same level and see that you're only bending it backwards. And that is when you are actually stimulating the muscles at the back of the thigh or the hamstring muscles. Exercise 7, back knee strengthener, level 1. Moving the left leg. 5, 4, 3, 2, 1. Swapping legs. 5, 4, 3, 2, 1. Exercise 7, back knee strengthener, level 2 without the chair. Stand up straight and look straight ahead. Clasp both your hands and hold it about 6 inches away from your tummy. Slowly bend the knee of the left leg until it is at a 90-degree angle. Once the left leg is at a right angle to the thigh, slowly lower the foot to the floor. The foot should be lifted backwards by bending the knee. Ensure that the knee thigh does not move forward when doing this exercise. Lift up on a count of 2 and return to the original position on a count of 3. Repeat 5 times. Swap and alternate legs and repeat 5 times. It is important to note that we have to bend the knee backwards and not to bend the knee this way. So you have to align both the thighs or both the knees at the same level and see that you're only bending it backwards. And that is when you are actually stimulating the muscles at the back of the thigh or the hamstring muscles. Exercise 7, level 2 without the chair, back knee strengthener. 5, 4, 3, 2, 1. Swapping with the other leg. 5, 4, 3, 2, 1. Exercise 8, side plank. Level 1. Lie on your left side and support the upper body on the left elbow. This exercise can be done on the floor or on the bed. If on the bed, use a firm mattress. Keep the knees bent backwards. The trunk and thighs should be in line. Now, draw in the belly button towards the spine and at the same time pull up the muscles in the floor of the pelvis. Then, lift the hips up, pivoting on the knee till the trunk and thighs come into a straight line. Maintain this position for a count of 10. Relax and lie back down on the floor or on the bed. Repeat 3 times. Exercise 8, side plank level 1. Lifting up and holding for a count of 10. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Then swapping to the other side. And keeping your thigh and your trunk on the same line, lifting it up. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Exercise 8, side plank, level 2. By keeping the knee straight. Only progress to this level if you're confident with level 1 described previously. Lie on your left side and support the upper body on the left elbow. This exercise can be done on the floor or on the bed. Keep the knee straight and place the right foot in front of the left foot. The trunk, thighs, and lower legs should be in a straight line. Now draw in the belly button towards the spine and at the same time pull up the muscles in the floor of the pelvis. Then lift the hips and legs up, pivoting on the feet till the trunk and thighs become straight. Maintain this position for a count of 10. Relax and lie back on the floor or on the bed. Repeat 3 times. Exercise 8, level 2, side plank, keeping the knee straight. So the trunk, the thighs and the legs will be in a straight line. And then you're pivoting off the foot and lifting your body up and holding it for a count of 10. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And slowly lower it down. Then swapping to the other side. Again, keeping the trunk straight, resting on your elbow and forearm pointing forwards, and the left foot forwards, and pivoting on the foot, count for a count of 10. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Exercise 9, back plank, level 1. Lie on the back with the arms by the side. This exercise can be done on the floor or on the bed. Bend the legs at the knee while keeping the feet flat on the floor. Now draw in the belly button towards your spine and at the same time pull up the muscles in the floor of your pelvis. Then push the hips up off the floor so that the trunk and thighs are in a straight line. Hold for a count of 10. Relax and lie back down on the floor or on the bed. Repeat 3 times. Exercise 9,
back plank, level 1. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Exercise 9, back plank. Level 2, arms folded in the front. Only progress to this level if you're confident with level 1 described previously. Lie on the back with the arms folded in the front of the body. This exercise can be done on the floor or on the bed. Bend the legs at the knee while keeping the feet flat on the floor. Now draw in the belly button towards your spine and at the same time pull up the muscles in the floor of the pelvis. Then push the hips up off the floor so that the trunk and thighs are in a straight line. Hold for a count of 10. Relax and lie back down on the floor or on the bed. Repeat 3 times.
Exercise 9, level 2, back plank with the arms folded in the front. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Exercise 10, knee bends. Level 1, supported. Place 2 chairs, one behind the other. Stand between the 2 chairs and hold on to the backrest of the chair in front. Stand straight with the feet shoulder width apart and pointing forwards. Start by bending both the knees and hips, pushing the buttocks backwards as if attempting to sit down into the chair behind. Try to keep the knees directly above the feet. Stop when the buttock reaches halfway position between the standing and sitting position. Then straighten the knee and hip and return to the starting position. Initially, it may be difficult to reach halfway between the standing and the sitting position. In that case, only go down an inch or 2. Slowly with time, as the strength increases, the movement will improve. Ensure that the buttocks do not hit the seat. Repeat 5 times.
Exercise 10, level 1, knee bends. 5, 4, 3, 2, 1.
Exercise 10, knee bends. Level 2, without the chair in front. Stand straight with the feet shoulder width apart and pointing forwards. Clasp both your hands and hold it about 6 inches away from your tummy. Start by bending both the knees and hips, pushing the buttocks backwards as if attempting to sit down into the chair behind. Try to keep the knees directly above the feet. Stop when the buttock reaches the halfway position between the standing and sitting position. Then straighten the knee and hip and return to the starting position. Initially, it may be difficult to reach halfway between the knee, the standing and sitting position. In that case, only go down an inch or 2. Slowly with time, as the strength increases, the movement will improve. Ensure that the buttocks do not hit the seat. Repeat 5 times.
Exercise 10, level 2. 5, 4, 3, 2, 1.
Exercise 11, heel raises or tiptoeing. Level 1. Begin standing behind the back of a chair and hold on to the backrest for support. Stand straight with the feet shoulder width apart. Now slowly raise both heels off the ground to tiptoe. Then slowly lower the heels down. Repeat 5 times. Exercise 11. Heel raises or tiptoeing, level 1. 5, 4, 3, 2, 1. Exercise 11. Heel raises, tiptoeing, level 2. Without the chair in front. Stand straight with the feet shoulder width apart. Clasp both your hands and hold it about 6 inches away from your tummy. Now slowly raise both heels off the ground to tiptoe. Then slowly lower the heels down. Repeat 5 times. Exercise 11, level 2, without the chair, tiptoeing or heel raises. 5, 4, 3, 2, 1. Exercise 12, sit to stand. Level 1, supported. Sit on a chair towards the front. Have another chair in front. Bend the knees slightly so that the feet are under the thighs. Tucking the feet slightly increases the ability to stand from the sitting position. Hold on to the back of the chair in front. Now stand up from the sitting position. Once the upright position is reached, slowly sit down, holding on to the chair in front for support. Repeat 5 times. Exercise 12, level 1, sit to stand. 5, 4, 3, 2, 1. Exercise 12, sit to stand, level 2, that is without the chair in front. Sit on a chair towards the front. Bend the knees slightly so that the feet are underneath the thighs. Clasp both your hands and hold it about 6 inches away from your tummy. Now stand up from the sitting position. Once the upright position is reached, slowly sit down and repeat 5 times. Exercise 12, level 2, without the use of a chair. Sit to stand. 5, 4, 3, 2, 1.